Hello everyone, and welcome to another episode of Ask Dr. Bob. Have some very interesting questions today. This individual says, I'm a 35-year-old overweight female. I've been on the cellular healing diet, but I have low blood pressure. Currently my blood pressure is 92/60. It's especially lower in the morning. She wants to know what to do. We have seen literally an epidemic of subpar or very low blood pressure readings, especially in women. Oftentimes it's a need for B vitamins, but it's really a body signal for adrenal fatigue. There's a great book called The Adrenal Fatigue by James Wilson. And in that book, and one of the reasons that I don't promote fruit, because fruit can compromise adrenal function, so can sugar, and so can stress. So we use several products, but we always support adrenal function. And we've seen that type of low blood pressure turn around in a month time period with appropriate supplementation. Somebody wanted to know if dark chocolate is healthy. I want you to know that we don't really promote chocolate in our practice. There's another great book called Potatoes, Not Prozac by Kathleen Desmaisons, and she goes into great detail. That's Potatoes, Not Prozac by Kathleen Desmaisons, and she goes into detail, as I just mentioned, about the negative aspects of chocolate. I do know there are chemicals in chocolate that can cause some emotional distress. The individual also asks, can chocolate lead to breast cyst? Well, I have found one of the leading causes of breast cyst from my observation happens to be not enough iodine. I would not eat chocolate for a variety of reasons. Okay, next question. What kind of iodine do I take? There are many different varieties of iodine out there. In the past, I used a product from Standard Process that was prolamine iodine. I used another product called iodoral. At the present time in our practice, we use a product called iodozyme from Biotics Research Corporation. And there are a variety of iodines like I mentioned to you, but before you would take iodine, I would encourage you to have either one, a urine iodine loading test to check your iodine levels, and or a thyroid panel and check your T, that's T4, TOM4. And if your T4 is less than the midline on the reference range, you may need some iodine support and some L-tyrosine. Dr. Bob, I know you drink half calf, half decaf coffee. What kind of chemicals are they using in decaf? Well, I want you to know the type of decaf coffee that we use is Swiss water processed. That means that there are no chemicals used to the best of my knowledge. I know that oftentimes commercial related decaffeinated processes use chemicals to extract the caffeine out of the coffee itself. So we have a roaster that provides our decaffeinated coffee. Iodine in infants, wanted to know my opinion. So I did a little bit of research on this myself. Iodine deficiency in pregnancy, infancy, and in childhood, and its consequences of brain development. I'm not going to sit here and tell you that everybody on the planet should be on iodine, but I do know that bromine, fluorine, and chlorine can take iodine out of the body. So if I had an infant or a child that is having growing pains, that means that they're constantly complaining about pain in different parts of their body, we use a liquid iodine that has either 75 micrograms in a drop or has 150 micrograms. I would just talk to your natural health care provider. You don't want to just start giving somebody iodine just for the sake of doing that. You may consider some macrobiotic green sea vegetables as a source of natural iodine. So let food be the medicine and medicine be the food. So you have to be just really careful because you don't want to overfeed an infant or a child or a toddler and cause imbalances. Once again, some tremendous questions. I pray this makes a difference in somebody's life. Pass it on.